Hello, welcome to today's lesson. In this video, we will be discussing what is depression, its signs, symptoms, and triggers, effective school programs and interventions for students, and lastly, the school counselor's role in dealing with parents and community.
Depression. What is it, and what are the statistics on depression? To begin, depression is a common mood disorder, limiting psychosocial functioning. It diminishes the quality of life. Depression can cause negative feelings that lead to sadness. It causes a loss of interest in daily activities. Someone with depression may feel the effects emotionally and physically. These effects can cause problems that affect functioning at work and at home. So some statistics on depression. To begin, in 2008, the WHO ranked major depression as the third cause of burden of disease worldwide and projected it to rank first by 2030. 20% of teens experience depression before adulthood. 20 to 50% of teens have a family member that suffers with depression or another kind of mental disorder. And about 2/3 of teens with major depression also battle another mood disorder like anxiety, antisocial behavior, or substance abuse.
Hello, everyone. I will be talking about the signs, symptoms, and the triggers of those adolescents who experience depression in their lifetime. Regarding the signs and the symptoms of those adolescents who experience depression, they may sometimes feel crankiness or anger, feeling of sadness, loss of hope, changes in their appetite, whether they eat more or extremely less, excessive crying, thoughts of suicide, low concentration levels, and physical complaints. Again, these are all some, but not all of the signs and symptoms that these young children face on a day-to-day basis. Next, we will be discussing the various triggers of depression. Oftentimes, many individuals want to know the reason or causes or triggers of depression to formulate in the lives of individuals. Well, any form of abuse, whether it be sexual, physical, or even emotional abuse, can also formulate triggers of depression. There are also certain medications that one can take that can also cause depression to formulate as well. A recent death or a death or loss of an individual in their life can also be a huge trigger of depression. Genes. Many don't know that genetics can also play a role in the formulation or trigger of depression as well. Major events. So these can be deemed as various traumatic events that have taken place in the life of an individual can also cause depression. Various medical problems or even age can be a trigger of depression. And lastly, conflict. If there's a conflict in an individual's life, this can also be a trigger of depression.
Schools are an ideal place to provide mental and behavioral health services to children and youth. They help provide prevention, intervention, positive development, and regular communication between school and families. According to research, students are more likely to seek counseling when services are available in school. School-based programs are implemented in school settings to help support adolescents with elevated internalizing symptoms. These programs help students prevent, identify, and treat mental health challenges. School-based prevention intervention programs help students with empathy skills, resilience, problem-solving, pro-social behavior, academic performance, violence prevention, and potential to reduce symptoms of anxiety and depression. Examples of programs and interventions in schools: Cognitive Behavioral Intervention for Trauma in Schools, CBITS, Classroom Support Aligned with Positive Behavior Interventions and Supports, PBIS, Individual Education Plans, Risk Assessment and Threat Assessment Management Teams. Since depression increases suicide risk, school-based programs offer suicide prevention programs. Suicide Threat Prevention Liaison, or STPL, is a group of individuals created by the administrator of the school that consists of mental health professionals such as psychiatric social worker, pupil services and attendance counselor, school psychologist, or school counselor. A suicide risk assessment form, STPL must complete an assessment form when a student expresses suicidal behavior, is engaging in self-harm, receives a psychiatric evaluation, or is hospitalized. Initial safety planning should be developed in collaboration with the student's input. Safety plan. STPL and student complete a safety plan that identifies triggers, emotions, warning signs, coping skills, school support, and home community.
Counselors and parents. School counselors work with parents to help students with school work and also their social emotional development. School counselors can collaborate with parents to increase positive outcomes for their children at risk for depression or those already showing depressive symptoms. They can educate parents on how to deal with their child's behavior in a positive way. Also, encouraging them to use various community resources for evaluation and treatment. Lastly, including parents in their child's treatment can increase the overall outcome of the child. Counselors and community. According to research, counselors' investment in the partnership of school-family community collaboration enhances student achievement. School counselors can provide vital information to mental health professionals in their community, such as other educational personnel, physicians, and clinical mental health providers outside of the school. They can also become part of the treatment team with the community to reach a common goal. Here is a letter that a 13-year-old boy named Cameron wrote after attending therapy counseling. 1. It has increased my grades ever since I first started. 2. It has heavily impacted my emotions, and I am much happier since the start of the program. 3. My life would have been more than likely worse without it. Grades would probably be much worse than before, and I would still be depressed. 4. My weekly sessions with blank blank has straightened my life out the most. 5. Everything about it matters. It helps me gain control my life and puts me in a better position for the future. 6. I would say yes, because it was so helpful to me, and through my own experiences with the program, it would help struggling students like I was. We are Team 5. Tamara Morris, Miranda Perez, Myra Sanchez, and Ingrid Solorzano. Thank you so much for watching our video. Here are the references that were used.